The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Kim Thorne Motors, and of course our technical producer, Steve Potter. This morning in the studio with me is Brad White, a compounding pharmacist, and our very special guests from Mercy Medical Center? Okay. I was thinking it was supposed to be the other people today. Daniel Lane, registered nurse and director of quality and risk management. Laura Miller, Master of Science in Nursing and Director ICU Dialysis, and Tammy Colley, RN, MSN, 5 Main, 10 Main, Nursing Director. Thank you for joining us this morning. It's a lot of stuff.
Good morning.
Okay.
Good morning.
All right. Patient safety is a serious global health issue that impacts people of all ages, races, and pretty much every health category. It's at the forefront of patient care. Concerns range from transportation of a patient to treatment and medication. Today we're going to walk through some of these issues and potential risks patients face, as well as steps local healthcare providers are taking to ensure patient safety. I'd like to remind our listeners today that our broadcast is also available on our podcast, and it can be downloaded from the App Store from your smartphone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs at any time. If you have questions during today's program, we invite you to post them up on our live Facebook feed, or you can give us a call today at 330-450-1480.
So, Dan, Laura, and Tammy, can you tell us a little bit about yourselves? I guess we start there.
Okay. My name's Tammy Colley, and like you said, I'm the director of 5 Main, 10 Main at Mercy Medical Center, which is medical and telemetry step down. I've been a nurse for a little over 30 years, and I've been in leadership for about 10. And I've been at Mercy for 3.5 years, and I love my job, and I love all the good things that we do at Mercy. And thank you for having us.
You're welcome.
Hi there. I'm Laura Miller, and I am the director of the intensive care unit as well as the inpatient dialysis unit. I have been at Mercy for 1.5 years now. I have been in nursing for 30 years and love what I do.
Good morning. My name is Dan Lane. I'm the Director of Quality and Risk Management at Mercy Medical Center. I've been a nurse for 20 years. I've been in healthcare for 30 years. Been at Mercy for about 6 years, and it's been a great experience. So thank you for having us today.
You're welcome. So today we're talking about patient safety. There's been a lot of talk in the news about medical errors and patient deaths over the past years. Why is patient safety such a concern?
Well, despite progress in patient safety over the years, studies suggest that medical errors and preventable harm are major sources of injury and death among patients. A recent national survey by the University of Chicago found that 1 in 5 people reportedly experienced a medical error in their own care, and 1/3 reported an error in the care of a close friend or relative. Encouraging news is that nearly half those who say they experienced a medical error spoke up about it and reported it to somebody on staff. Of those who did not speak up, they did not think that would do any good or that they would know how to report the error. So we have areas for opportunity. We need patients and relatives to speak up when they think there's an error. They need to be engaged in their care. So a strong safety culture also means an environment where clinicians and staff feel safe to speak up and address concerns when they see fit. So these sound like issues that have potential to cause more significant harm to patients. What are hospitals in general doing to address the potential issues?
Well, there's many initiatives that we have implemented to protect our patients. One of them is using 2 patient identifiers anytime we give a patient a medication. For example, if I'm giving my patient a medication, then I'm going to ask the patient to give me their name and their date of birth. We also do assess our patients depending upon the acuity of the patient every 2 hours, every 4 hours, every 6 hours to look for those subtle changes in the patients. We also use an interdisciplinary team approach so that every day we are rounding on every patient with the physician, with the bedside nurse, the dietary, respiratory therapy, pharmacist, so that we can address those issues with each patient in real time and make sure that we're meeting those patients' needs.
So, Mercy Medical Center has initiated numerous simple and sophisticated initiatives to enhance patient safety. What are some of these? You just mentioned a few, I guess.
Well, like Laura said, we do the multidisciplinary rounding on each unit. We also have a daily safety huddle on each unit. Handoff with the night shift, hands off to the day shift hands off to the night shift at the end of each shift. But we also have a huddle every morning where we meet the leaders. We all meet, and if there's any issues or anything that we need to bring to the forefront for patient safety or to help with patient throughput, staffing, or any of those kinds of things that could affect our patient care. Just to kind of back up for a minute, hospitals are very much like the aviation industry. We're a high reliability organization. So all these things that we're talking about, they're checkpoints and processes that we've put in place to ensure safety, not just at the patient level, but all over the hospital to protect visitors and staff. So,
I drive by both hospitals sometimes multiple times in a day. And, of course, when I go home at night, 6 o'clock or whatever it is, parking lots are empty, okay, practically, okay?
Yeah.
So how do you, through the night period, when staffing is a lot lighter, how do you manage some of these things? I probably don't really know, and all those cars that are gone at night, those are probably people who do surgery and other things like that throughout the day. But are the units generally in all hospitals staffed as much at night as they are during the day?
Yes. The night shift they usually park in the parking deck.
Oh, okay.
So that's
So
probably
we're hiding there.
Oh, okay. Okay. I guess I never thought of that.
Right.
Okay.
And we have security, of course, 24/7, and
Sure.
and they do their rounds and are always available to help and assist staff with whether it's outside on the hospital grounds or
Sure.
on the actual units.
And that is one part that about a hospital is it doesn't close. It doesn't close for the holidays.
Sure.
It doesn't close for the weekends. It is a 24/7, around-the-clock type organization. And so those services that are vital to the patients are there at all times. We have lab. We have, X-ray, radiology. We have surgery. There are people there from surgery so that if something comes in, a trauma comes in, and we need to emergently take a patient to surgery, and we ensure that we have those staffing levels exactly where they need to be so that those patients can receive that 24/7 care.
Okay.
Right, and I think it's important to realize that even though maybe we're not there during the day, the safety mechanisms are always in place. So we scan barcodes for medications and blood administration. We try to have those hard stops in to make sure that patient safety is always a priority, no matter what time it is.
Well, I'm probably not the only person that's ever thought about
Right.
that.
Sure.
Because I go by there so many times, and I'm thinking, gee, there's nobody there.
Yeah.
Well, visitors go home too.
True.
So
Yeah.
I'm glad I asked that question. I'm glad you told me where these people
Yeah, they're
are.
on the parking lot. Yeah.
And it's obviously that way at other hospitals, is they want to keep the people close in so they don't go out alone or go to their cars alone
Right.
and that sort of thing. So
It's a great benefit to work night shift. You get to park in the deck and you go out. You don't have to scrape the snow off your car. You're not getting wet in the rain. It's a short walk. So some of the other things we've done at Mercy Medical Center this year for patient safety, we have senior leaders, our CEO, our chief nursing officer, our CFO, our chief financial officer, our vice presidents. We round on nursing units every week. So we did take the team up, we split up, and they go talk to the staff, ask them what their barriers are to patient care, what needs fixed. Mm-hmm. And it's created a great roundtable discussion with everybody about, how can we do things a little bit better? How can we get the bedside nurse involved, all the other bedside staff? And how can the departments work together to create better patient care and safer care for patients?
And the staff have really appreciated the openness of leadership and their availability, transparency. They feel very comfortable to ask questions and to get clarification on things that that maybe the directors or the managers may not know. So it's been a very positive thing that we've brought to Mercy. So.
Right.
So I guess this is National Patient Safety Awareness Week, or is that next week?
It starts Monday.
Okay. What can you tell us about this event?
Patient Safety Awareness Week is it's a designated time to create awareness for patient safety. It's a time when we ask that patients and families become involved and be engaged with patient safety and in their own health care. So it's just not taking a backseat approach to your health or being in the hospital. It's asking questions. It's engaging the staff, engaging the physicians. What's this test for? How can I help? How can we do something better? What can we do to understand what's going on with my health? And so that's really the goal is for everyone to be up front and be aware that patient safety is number one, and how they can become involved in things.
I think it's important too to mention that we want to empower the patients and their family members to speak up if they see. We have these buttons on that say "Ask me if I've washed my hands." So, it's just something that has to be done. And we'll talk in a little bit. We'll talk more about hand hygiene, but we give the patients and the families the opportunities to also hold us accountable.
Yeah, we have like telesitters now. So, Laura, you want to talk about telesitters? It's her baby.
Yes, Mercy Medical Center purchased 8 of the telesitter monitors last year. And what this does is it allows us to monitor the patient. The monitor is brought into the patient's room, and there is a monitor tech who has eyes on this patient at all times. So that way, if you have a patient who is a high fall risk and needs reminded not to get out of bed, or is a little confused, or you just feel like you just need that extra set of eyes on them, they're there. There's someone visually seeing them at all times. It allows for two-way communication between the patient and the telesitter, who then also has the ability to contact the RN if they have any concerns, if the patient's getting up or is at risk. We recently had a patient who had the telesitter on, and the patient just showed subtle signs of increased anxiety that no one was in the room at the time, so no one was noticing that. But that monitor tech picked up on these very subtle key signs, called the RN. The RN was able to go in, speak with the patient, address their concerns and kind of de-escalate the situation. Little things like that may be missed otherwise.
Okay.
And I think it's very reassuring for patients and families to know that they have that service.
We have to take our first break now. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White for the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on MedShopRx.com. We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're discussing patient safety with experts from Mercy Medical Center, Daniel Lane, Director of Quality and Risk Management, Laura Miller, Director ICU/dialysis, and Tammy Colley, 5 Main 10 Main Nursing Director. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed. So we're talking about next week's National Patient Safety Awareness Week, and we're wondering if you're going to hold some special events next week.
We are. So we're celebrating successes from each day by sharing patient safety stories from each department. We've invited departments all over the hospital to submit stories of how they contribute to patient safety and any kind of special stories and great catches they may have had. So we're actually going to review those this afternoon, and then each day next week we'll post a story for the hospital to read, and hopefully we'll also share those on our Facebook and Twitter page as well, Mercy Medical Center.
So how do we get the listeners to participate in all this?
Well, there's a lot of things they can do, and probably one of the most important things they can do is go to a website called unitedforpatientsafety.org. And there's a lot of education that patients or consumers can follow there. There's videos on health literacy. They can download medication safety tips for patients. There's myths and facts about diagnostic errors and how to talk to physicians. A checklist for getting the right diagnosis. A list of 10 things I can do tomorrow to reduce errors for patient safety. And there's also other webcasts from previous safety awareness weeks that they can watch and contribute to. So there's a lot of stuff they can do out there, but the number one thing they can do is be engaged and be active with your health care.
Sure.
So I'm sure there might be some examples on there where patients can be more involved with their health care and be more safe in the healthcare environment. What tips can you give some patients, just as an example?
I think a lot of things we can do. Mercy Medical Center has a patient portal. So you can actually, from anywhere in the world with internet access, you can access your health records from Mercy Medical Center. So if you need to know maybe you're out of town and you're having something going on, you can access what your latest lab work says, your X-ray reports. And that's just one example of technology now helping patients be more involved and active in their health care. I think that we have other areas we can use.
One of the things I think I've already mentioned it, but to encourage patients and their families to ask questions. So if they are getting a new medication or they're going to be going for a procedure that they're not familiar with, to ask questions of the nurse and the physician, and to not just assume that we assume they know what's going on. So we always want them to ask questions.
You kind of went where I wanted to go without, I don't want it to sound condescending, but it is a two-way street. I've thought about situations in the past where myself or my loved ones have been in the hospital, and what an advantage it is to be a pharmacist and to be able to ask questions about medications and treatments and have probably a level of understanding that maybe a person that isn't in the medical field does. So you can't just assume that everything's perfect, and I'm not passing any judgment on any healthcare professional in their environment, but I guess the more feedback you give your healthcare provider, the better they can help you. And if you don't tell them you have an allergy, they don't know. Right. And if you don't tell them that you can't move your arm this way, they don't know. Right. So, you know, you've got to ask questions and listen and be engaged, because healthcare is a two-way street.
I think that's where the bottom line is communication, communication, communication. It is vital to both sides understanding what the other is thinking, and it's the only way you can get that knowledge that you need.
Right. I know we've had instances where the family was at the bedside, the nurse was about to give a medication, and the family stopped and said, "What's that medication for? That doesn't sound like right. What my mom usually takes." And the nurse said, "Oh, let me check with the physician." A couple phone calls later, there was a potential for an error there. But we stopped it, and because those people were engaged in their healthcare, and I think that's always an important thing to do. And I know we partner with everybody to know your numbers, to get lab work done, so you know where your levels are at. So I think that's important. It's important to work together to know what's going on with you and your health.
There's an app for lots of things, but there's not an app necessarily for clear communication.
There isn't.
All right, let's talk about hand washing. And I made a joke before we started the radio show about it amazes me how many people don't wash their hands in particular environments that we don't need to go into right now. But let's talk about the healthcare environment. And, you know, it seems like it's the simplest, best way to control the spread of stuff you don't want to spread.
Absolutely. Right. And it is 80% of hospital infections can be prevented just from hand hygiene, something, the simplest act of washing your hands.
80%.
80%.
Yeah.
Wow. That's a big number.
It is a very big number. So, you know, it's something that we become increasingly focused on. It is now one of our big house-wide initiatives. That's why we've got our buttons that say, "Ask me if I wash them," with a big hand on it. We also have pins that say foam in and foam out. And really that's our focus now, is that prior to walking into any patient's room that you do use the foam hand sanitizer, and prior to walking out of any patient's room you use the hand sanitizer to ensure that we have clean hands before we touch our patients. And then having in the ICU, we have the signage, "Ask me if I wash them," on every patient wall, so that we can empower those patients to stop me as the nurse and say, "Hey, did you wash your hands?" We're doing a lot of education with staff, a lot of auditing, and a lot of real-time education on that.
Well, I would hope that it would go both ways, and it would make the patient think about also how important it is for them to do so. Maybe it might be difficult while they're bedridden, but maybe when they leave the facility, it'll make them leave a long-lasting impression.
Right. So we try to provide them with like towelettes if they're in bed, they're bedridden, they can get towelettes to wipe their hands off with, or some foam dispensers right there at the bedside. We've worked really hard with hand hygiene, so we were able to reduce our Foley catheter associated risks, associated infections by 50% over the last year. We've reduced C. diff infections by 25%. And really, research shows that you just can't check off, okay, this is April, March, May. We did our hand washing education for the year. This is something that has to be brought up every 6 months, right, to keep engaging staff and patients.
Okay, folks, this is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
You're listening to Health Matters at the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about patient safety. So we've got a lot more to cover this morning, so let's get back to the show.
All right, we're going to talk about medication safety in this segment, and it's kind of nice since we're pharmacists and we have pharmacies and we are equally invested in patient safety, and we can share some of both the mechanical and technical and procedures that we put in place to make sure that the right patient gets the right medication at the right time. And I'm quite sure that you guys have some things to share along those lines too. So why don't we talk about what the hospital at Mercy does to make sure the patient gets the right medication to ensure their safety?
Sure. So we do use technology. So we have a electronic health record where physicians enter orders into the computer. That automatically sends it down to the pharmacist. The pharmacist then reviews it on the computer, probably just like at your shop. We have a robot that dispenses a lot of the medications where it automatically pulls it from the shelf, sent upstairs, and then nurses talk to the patients. This is what your medication's for. We scan the bracelet, we scan the medication, double check there, and then electronically states on the medical record that it's been administrated as well. So we put a lot of effort into medication safety with our patients, and that is just a small part of how it works. So we just always want our patients to be involved and engaged with medication. Ask questions to your healthcare providers. When you get new medications, make sure you ask about side effects. Make sure you ask what the medication's for, how does it work, what interactions could happen, and just make sure you have a list of your medications so we all know what you're on it. And I'm sure you guys know how difficult that can be at times.
Right. So. I think we can't stress that enough, is for patients to always have an updated list of their medications with them, because there's times we've had patients come in with no list or a list from 5 years ago, and they're not even on half those meds. And another thing we really do stress, too, is do not bring the actual bottle of medications with you. Oftentimes patients will bring them, and they'll get left accidentally at the hospital, and we have no place to store those, and we cannot destroy them. So it's
well, you bring up a great point, and one of the wonderful things about the pharmacy software we're using now is we can actually print a nice little patient medication guide. You could fold it up, stick it in your wallet or your purse. It doesn't take up a lot of space. And at the pharmacy level too, we don't get a lot of chance to talk about things like this for what we do for medication safety. So usually people come in and they're tired, they're not feeling well, they're busy, they want to go home, and they can't understand why it takes more than 13 seconds to fill their prescription. Well, here's why. So much like you have just mentioned, our pharmacy system generally anymore gets the prescription electronically from one of your providers. We verify that with the insurance billing. We check for drug interactions. We use barcodes for more than just checking out at the grocery store. Mm-hmm. So, we use our barcode to not only check your prescription label against the medication we use to dispense your product, but it might also trigger the automation to fill that prescription if necessary, if it's in there. And then we use the same type of technology to make sure that when you're at the cash register and you're picking up your prescription, that the right person's getting the right medication that's in the bag. So there's a lot of unemotional or unjudgmental triggers, if you will, that we use, right. And it's mechanical. It's one thing for you to know, oh, look, Tammy's here to pick up her prescription, but at the same time, that computer just sees numbers, and it wants to make sure that that is Tammy's prescription.
Right.
So it's a nice double check, if you will. But so with that being said, let's talk about how important it is for the patients not only to have a relationship with their doctor, but also their pharmacist in the community. And I want to mention a few things that helps with patient safety in the community setting, just like it does in the hospital setting. And our guests can add any comments they may have to be additive to this. So first thing, I think it's extremely important, just as Tammy mentioned, that everyone knows what medication they're on, when they're to take it, and how they should take it. And if that means you have one of our handy little pocket lists, stop by the Medicine Center today and we can print one up for you in just a couple seconds. It's real convenient. But, we can even make little notes on there to tell you what the medication's for to help you. Because sometimes if you're taking more than 2 or 3 medications, it can get pretty complicated if you're dealing with a condition like heart disease or blood pressure. So I don't doubt that for a minute. It's kind of one of the reasons we help patients with packaging to make sure that they don't miss doses if they have trouble remembering to take multiple medications. Right. But, You should know what to do if you miss a dose of medication. Some medications need to be handled differently for different medical conditions. How to store your medications. I'll tell you right now, it's probably not a good idea to store your medication in your bathroom, especially if you like to take hot, steamy baths or showers, because that moisture could cause some problems. How your medications might interact with other medications or even foods or other environmental factors like sunshine. I know it's winter in Ohio, but there are some medications that might make you more prone to sunburn. And it's not that you shouldn't go out in the sun, but you just need to be aware if it makes your skin more sensitive. And how to safely dispose of medications. We have a terrible problem in our community right now with people getting access to medications that they shouldn't have access to. So please make sure you dispose of it properly. If you have questions on how to do so, please come see us at the Medicine Center, and we'd be happy to give you some guidance. There's also some ability to dispose of unused, outdated, expired medications at your local sheriff's offices. So that's something you can do.
And they run programs frequently throughout the year, on weekends and stuff like that, when you can take your meds and destroy.
Right.
A lot of people put them in coffee grounds, that sort of thing before they dispose of them. The worst place to put them is in the toilet because the water now carries hormones, morphine, and narcotics. But isn't it funny?
It is.
It's amazing.
We had to stop that same process at the hospital as well. We just went to RX Destroyer, so they can waste right at the in the hallway instead of using the bathrooms or sinks or stuff for the same reason.
Yeah.
Right.
And using that charcoal base to absorb those medications so that they're not just sitting around.
What amazes me about that is that there's that much medication dispensed and that much medication destroyed that it actually has raised the level of narcotics and hormones in the water.
Yeah.
Right. Yeah.
All right, there are more than 700 medications that used to require a prescription that are now available over the counter in pharmacies and supermarkets. Now, just because they're over the counter and don't require a prescription doesn't mean there isn't a safety issue and that you need to make sure you respect them and take them correctly. And I want to talk about a few common over-the-counter products that probably everyone has in their medicine cabinet at home or may have all taken at one time or another. And I want to talk about the risks that they should be aware of, and I welcome you guys to join me on these. But I have one that I want to start with, and probably the most popular item over the counter is acetaminophen, or Tylenol, or it may say non-aspirin pain reliever on the bottle, depending if you buy like our private label brand. But my story I want to share on this one is one that I learned even before pharmacy school. It was interesting. I was working with a group of contractors we were working on some project for the pharmacy, I think, and it was one of the first times that I realized how someone may perceive a medication that, they just thought it was going to help them. And the gentleman said that he woke up with a headache, so he took 2 Tylenol. He still had his headache in an hour. He took 2 more. He still had his headache in an hour. He took 2 more. And he did this all day.
Oh, wow.
Oh, dear.
And take like 85 pills or something.
He took like 36 pills or something.
Oh,
it was bad.
You're mad.
And happily, his girlfriend recognized that something wasn't right 12 hours later and got him to the hospital and saved his life. But I guess my takeaway is his comment was, it's over the counter. It doesn't require a prescription. I thought it was safe.
Mm-hmm.
I recently saw a study on, I think it was 8 different types of products that damage or affect your kidneys. And the nonsteroidals were the first ones that came up, that people are consuming too many nonsteroidals like Aleve and ibuprofen and Tylenol and even to some extent aspirin, I think, is not a dead product anymore, but it's still out there. But people used to consume large amounts of aspirin. And the other thing that caught my eye in this list was vitamins. That overdosing yourself on vitamins damages your kidneys. And I never really thought about that, as a pharmacist. But there's stuff in vitamins,
right,
that needs to be eliminated. So
yeah.
I guess we're probably on our 3rd break. Would that be about right? Okay.
All right, well, before we break, I got to say this real quick about Tylenol, and that is, please read your bottles. If you can't read, I will not judge you. Our pharmacist won't judge you. We want you to take these products correctly. So please get some help and make sure you respect what's on the label.
Well, and the print on some of these labels is now so small that you need a magnifying glass for most of it. So, okay, our 3rd break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White for the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on medshoprx.com. Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on medshoprx.com. Okay. Welcome back to Health Matters at the Medicine Center Pharmacy, and you're listening today with 3 individuals from Mercy Medical Center. I'm not going to say their names. We don't have any time. Let's go.
All right, before the break, we were talking about we want people to use over-the-counter medications to help enhance their treatment options without going to the hospital to see fine folks. But at the same time, we want you to respect those items and realize that just because they're available without a prescription, they could hurt you. Anything you'd like to share about any particular over-the-counter item or vitamin or supplement or herb that has been problematic in your experience?
Go ahead.
I just would say, like with Tylenol, so many different medications over the counter have Tylenol in them. So you might have your plain bottle of Tylenol, but then you have your NyQuil, and you have something PM that has Tylenol in it as well. So you could very easily overdose on Tylenol, and with liver complications with extra Tylenol, it's really a safety issue, and just be careful when you're taking Tylenol. But that also applies to Motrin too. I think I was a nursing student, and I remember a young kid like 24 coming in with a GI bleed, and the doctors were kind of stumped and found his girlfriend said he's been taking like 20 ibuprofens a day, and as we went to ICU afterwards, because he was in ICU just because he was taking so much Advil.
Wow.
Yeah. I know sometimes patients, whenever they do give us their med list, they will forget to put the herbal supplements on there. So we have to always make sure we ask, are you taking, even though it's not, you may think it's not a medication, are you taking any kind of herbal supplements? Because it could interact.
My sister years ago had surgery, and they couldn't stop the bleeding. She forgot to tell them she was taking a lot of aspirin.
Right.
So that was what I was just going to add, is so many of our patients especially our older population, are on a daily aspirin, and that does increase your potential for bleeding. So patients need to be aware of that risk, particularly if they have a fall, which may seem like a benign fall, but hitting your head, that type of thing, you really need to be aware of that bleeding potential.
Yeah, we have a lot of issues just with patients might know their medications from the pharmacy, but then their other medications they take from home, over-the-counter drugs, aren't on that list, and it's a patient safety concern for us all.
How about the patient that brings their medicine into the hospital with them and doesn't tell you that they're going to take these?
Right.
Yes, we have had that experience, definitely.
I've heard people talking about it.
Yes.
All the time.
Okay, so we mentioned falls a couple seconds ago here. And I know that's, a lot of people don't want to be in the hospital. They want to be more independent. They want to get out of bed when they want to. And boom, they're on the floor. So what have we done in the hospitals to kind of eliminate this?
Within the hospital, when a patient comes in, part of their admission assessment is to assess whether or not they are a high falls risk patient. If they are, we do place a armband on them along with a bright colored socks so that they're easily identified. Those patients we place bed alarms on to make sure that if they're trying to get out of bed, we're there quickly. We're continuously educating them on calling the nurse, making sure that call light is within reach so that they can call the nurse if they need to get up. And then that part of that, too, is looking at their medications. Are they on a diuretic? Are they going to need to get up frequently to go to the bathroom, so that we're all more aware of exactly what's going on with that patient.
Yeah, and in the ED, they started a geriatric fall risk program where they assess patients for falls. And if you're a high-risk patient, you're given a booklet, how to reduce falls at home. They send a letter to your primary care physician. You're eligible for matter of balance classes through our physical therapy, and you're also going to have a free therapy assessment. So there's lots of great things in that booklet, how to prevent falls at home as well. So I think the number one is to make sure you have an exercise program, or you just make sure your balance and strength are keeping up, so you don't fall.
And don't assume that just because you're getting older, it's okay to fall, because it's not.
Right.
Right. And I think Dan made a really good point that we really recommend that patients or anybody with exercise, strengthening, even doing yoga type exercises and stretching will minimize your opportunity to fall.
Right. And if you have to use a walker, use a walker. It's okay.
What about oxygen therapy? Now, I have a question here, which I've never heard this before, that a hospital wouldn't allow a patient to use chapstick with oxygen since it's petroleum-based.
Correct.
Right. So petroleum-based, bless you.
Is that true?
It certainly is true. There's a chance for petroleum-based products and oxygen to combust.
Yeah, sure.
So it really is one of those safety measures that we do take with patients wearing oxygen. 80%, 90% of O2 injuries are because of open flames, cigarette smoking.
Yeah.
Just even playing with a little toy that made spark or something like that. Any kind of thing like that when your oxygen is dangerous. The other problem at home is those long oxygen tubes around the house, tripping hazards, falling hazards. And I think too much O2 as well, right?
Right. Dan used to work in the ED years ago, and he was telling us stories about patients that came in that were on oxygen, and they would try to smoke and had
face burns.
Yeah, there's every once in a while a story comes out about that where somebody's smoking with oxygen and burns their face to pieces, And I still to this day can't get over the smoking thing. I just can't figure out why people are still smoking. Right. I mean, if it's even just the cost of cigarettes, but to still be smoking, you see people outside of their workplace, standing by the doorway or outside where they work, like a restaurant, and smoking. I'm thinking, come on. And I, in my lifetime, have picked up more cigarette butts than 10,000 people. Okay, wow. I mean. Parking lot. In the Army, the whole deal. Gee whiz. We're kind of getting a little tight on time here, so a couple more things maybe we can knock down here. So let's say a patient just had a successful hospital stay and they're ready for discharge. What do they go home with? I mean, what kind of counseling, literature? I know it might be specific to why they were in the hospital.
Discharge instructions and the whole discharge process is such an important part of the patient's overall success. So we really focus on making sure that they have a list of their medications. They understand their medications. In the ICU, we do have a pharmacist that comes up and speaks with the patient the day of discharge, reviews the medications, finding out if they have any questions and understanding exactly what those medications are for. And then reviewing, what are you allowed to do? What's your activity, your diet? When should your follow-up be? But another really important part of that is having someone there with you, a family member, that is also there to, another set of ears so that when you are discharged and you get home and you think, I don't remember anything they said. You have that paperwork and you have that person there who says, okay, this is exactly what you're supposed to be doing. And they also have contact information for the physicians so that if they just aren't sure, they can call the office and find out.
Right. Yeah. And discharge instructions aren't handwritten anymore, so they're computer generated. Sure. So you can easily read the care instructions, when to call 911. Prescriptions for labs and x-rays can be sent electronically to the pharmacy, electronic prescriptions now. And we also make sure that your primary care physician gets a copy as well. That way they know what happened while you're in the hospital, because many primary care physicians don't come to the hospital anymore. So they need to know what happened to you while you were there, too, for your next follow-up visit.
Our stores, medicine center pharmacies, carry a lot of patient-assistant items like bath rails and potty chairs and seats and walkers and rollators and all that sort of thing. So right now we have a massive inventory of bath rails. I don't know where they all came from. Right, all sizes. So if you're looking for one of those, we got them. Okay, folks, we're out of time. And you thought we were going to be done in 15 minutes.
We did.
Okay. All right. Thank you to our special guest, Dan Lane, Registered Nurse and Director of Quality and Risk Management, Laura Miller, Master of Science in Nursing and Director of ICU's Dialysis, and Tammy Colley, RN, MSN. There's a lot of degrees in this room.
There is.
There is a lot of degrees. 5 Main, 10 Main Nursing Director at Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and, of course, our technical producer today is Steve Potter. Tune in next week to hear Mercy Medical Center's Nicole Solinsky, who will tell us about unique nutrition diabetes a unique nutrition and diabetes program. Mercy is going with the NFL. As always, we thank you, listeners, for joining us with Health Matters in the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.